Drive-through and 24-hour service pharmacy store. 85% of customers in the US live within 5 miles of a CVS location. The convenience CVS provided not just helps people from pain and suffering, but also saves lives. As for mild or prolonged health conditions, patients can easily get their prescriptions anytime, anywhere, not congesting the hospital for those who are in dire need. Imagine if the government provides highly subsidized healthcare benefits. This seemingly good cause may fail humanity. For someone gets medical treatment, there will be a cost. Someone must pay the cost. Therefore, when it comes to highly subsidized healthcare welfare countries, the patients do not feel the cost, and it will inevitably subject to abuse and less accountable to taking care of their own health. And the accountability will be paid by others who take good care of their own health. Worst of all this became hidden charges. I don't even know when and why the price changed and hiked, and it's charging the taxpayers in the United States. Imagine the beneficiary can't even say thank you to the person who shared the burden. He or she might even say, "Why say thank you? That's what I deserve." Joke aside, this is one of the common tactics used by politicians to gain favor, like Obama introducing Obamacare and Biden making it permanent. 10 years after Obamacare was signed into law, it has failed to live up to its promises to reduce healthcare costs, increases access, and improve healthcare quality. With its dramatic premium increases, decreased access, and reduced choice in insurer markets, Obamacare has done the exact opposite. This failure has been called for and ended by President Trump, who should have better understanding of money and economy. If not, he won't be a billionaire with his own effort, unlike other politicians who get rich by being politicians. According to the Kaiser Family Foundation, the recent 2022 family glitch fixed by Joe Biden makes an additional 5.1 million people eligible for subsidized coverage. It looks good superficially, but that also means even families with healthy 6-figure incomes receive subsidies. According to the research published by Galen Institute, a family of 4 headed by a 45-year-old earning about $200,000 a year gets an annual subsidy of $2,210. Even some families earning more than $300,000 get a subsidy of more than $1,000. I guess there is a rich glitch now. Now, let's talk about one of the largest healthcare companies in the United States, CVS, who will expand its Obamacare plans to 12 states as announced in August 2022. I guess they just can't wait to hike the price right now. This I will explain later in the video.
CVS Health Corporation is an American healthcare company that owns CVS Pharmacy, a retail pharmacy chain. CVS Caremark, a pharmacy benefits manager, and Aetna, a health insurance provider, among many other brands. The company's headquarters is in Woonsocket, Rhode Island. Consumer Value Stores, CVS, started in Lowell, Massachusetts, was founded in 1963 by 3 partners, brothers Stanley and Sidney Goldstein, and Ralph Holland, who grew the venture from a parent company, Mark Steven Incorporated, that helped retailers manage their health and beauty aid product lines. The business began as a chain of health and beauty aid stores, but within several years, pharmacies were added. To expand, the company joined the Melville Corporation, which managed a string of retail businesses. Following a period of growth in the 1980s and 1990s, CVS Corporation spun off from Melville in 1996, becoming a standalone company trading on the New York Stock Exchange as CVS.
Okay. On 3rd September 2014, it was announced that CVS, as of midnight Tuesday, September 2nd, 2014, would no longer sell tobacco products at all of its 7,700 locations nationwide. A month earlier than planned, it also announced it would change its corporate name to CVS Health to reflect its broader healthcare commitment and a desire to change the future health of Americans, although all retail stores would continue to be called CVS Pharmacy unless they did not contain a pharmacy, in which case they are just signed CVS. In December 2017, CVS agreed to acquire Aetna for $69 billion and completed the acquisition in November 2018. In the same month itself, CVS Health announced that the company plans to close 900 stores over the next 3 years, with closing due to begin in the spring of 2022. Legal issues related to the merger were resolved in September 2019. In February 2020, CVS Health announced changes to its board of directors, whose size was reduced from 16 to 13 directors. Most of revenue comes from the PBM sector. In other words, it is the amount that insurers and the plan members, whereas maximum money comes from retail pharmacy stores like CVS Pharmacy. CVS Health makes money primarily from the health insurance field as per the prescription drugs. CVS Pharmacy division is responsible for more than 67% of its revenue. The term pharmacy in this context is a little misleading, and this particular sector of the business should probably best be styled as retail. It includes not only dispensing prescriptions and administering flu shots, but all the convenience, sundry sales normally associated with visits to the drugstore. Everything from candy and cookies to as seen on TV novelties, like Snuggies and Slap Chops. CVS Medical Clinic operations branded Mini Clinic include 1,100 retail clinics in 33 states. CVS entered this industry relatively late but has already become the market leader. In 2021, CVS Health was ranked 4th on the Fortune 500 list and 7th on the Fortune Global 500 list. CVS revenues are products, premiums, services, and net investment income, mainly products. For the 3 months ended September 30th, 2022 compared to the prior year, total revenues increased 10%, driven by growth across all segments. During the 3 months ended September 30th, 2022, the company incurred an operating loss of $3.9 billion compared to $3.1 billion of operating income in the prior year. The difference was primarily driven by $5.2 billion in addictive drug opioid litigation charges and $2.5 billion loss on assets held for sale to write down the company's LTC business in the 2022. Max has developed the most resilient quant algorithm ever. We will show you now. Okay, Max, what do you think about CVS stock at the moment?
For the past 1 year, we can see here CVS stock starting from 102 US dollar. Okay, to now the price is 93 US dollar. You have declined for about 8.63% in terms of the share price. But if let's say if you were to capture every movement for the past 1 year, the uptrend and downtrend from the data here, we can see that you actually can for every 1,000 you invest, you will have a 56.9% gain. That means your 1,000, every 1,000 will become $1,569.14. Okay, and the risk, the maximum risk is only 24%. That means you will have a 56.9% gain with the risk of 24%. That means every $1 risk you take, you will have a more than $1 gain, more than $2 gain.
Okay, that's the magical part of Max Quant algorithm, where the market is going down, where they lose how many percent again?
Here from the data we can see is 8.63% for the past 1 year.
Yeah, negative 8.63%. And by using Max algorithm, during the same time, for the same market, you will earn about 50+%. Okay, so if you want to learn more about this quant algorithm, I have put down the link below in the description. You can join Max's webinar on how to invest and trade multiple assets in global market. Okay, in this webinar, Max will show more case study on how you can use this system to automate your wealth, right? Anything more to add on?
Yeah, there are a lot of things I want to share with you in the future and probably in the next video.
Yeah, so please subscribe our channel. Subscribe our channel so that you can learn more from Max and then other companies how to invest in them as well. And please comment down below what do you think about CVS, this company, and how can you, like, what do you think that we can improve on? Like, what do you want to learn more? What do you want to hear from us? What do you want to hear from Max as well? Like, yeah, any things you are interested in. Please, you can comment down below, and then perhaps we can answer you or perhaps even make a video for it. Thank you so much for watching. We will see you next time.
See you.